Good. Oh, excuse me. Good morning, everyone. I am Megan Rogers with Indiana SHIP. I am the volunteer supervisor for the Northwest region of Indiana, and I am your solo host this morning. I am flying solo. Susan had some outreach events this morning, so I am your host on July's What to Know Wednesday. And we are going to talk about veterans benefits and Medicare, how they work together and how they don't work together. So there's a few different types of veterans benefits that we're going to talk about, and how they do or don't work with the health portions of Medicare and the drug portions of Medicare. So feel free to chat in the chat box as we go along. I will be watching that. If there's delays with my presentation, I'm looking at my phone at the chat box. Or if there's delays with me answering questions, it's because I haven't looked at the questions yet. So just bear with me this morning. I will get to them. And as always, the presentation this morning will be on our Facebook for 30 days, and we will also have it up on our YouTube channel. And we do watch our comments and our Facebook Messenger for questions or comments after the fact. So feel free to message us or comment in the chat box even when we are not live, and we will respond to those as we see them. Susan and I are one of the individuals that respond to chat questions or Facebook Messenger questions. So you may hear from us when we're not on a live. So without further ado, let me get the slides back up here and we will start talking about veterans benefits. All right. So, okay, so there are different ways to get healthcare, government healthcare when you are a veteran. So we have TRICARE for Life. We have services through the Veterans Administration. We commonly abbreviate that as the VA. So when I say VA, that's what I'm meaning, the Veterans Administration. And then Medicare. All of these are versions of government insurance. So TRICARE for Life is for individuals that are retired from the military. So your military personnel, that has been your career for years and you're retired. While you're working there, you're generally having what's called TRICARE insurance, you and your family, you and your spouse. So when you retire, then you get TRICARE for Life. So, and this is for people who do have Medicare. So you are required, if you want TRICARE for Life, to have Medicare, and they work together. So your Medicare Part A and your Medicare Part B are going to be your primary insurance. So when you're eligible, you're going to take your Medicare like normal. And then you're going to get your TRICARE as your secondary. So if you know anything about Medicare from our previous lives, you may know that there's Medigap supplements out there or Advantage plans. And those are usually our common secondary pieces of Medicare insurance. Well, TRICARE would be your supplement, your secondary piece of insurance for your Medicare. So for this option, you do need Medicare and they work together. And you can go anywhere that takes Medicare or that takes TRICARE. They work together. So then we have VA healthcare. This is not insurance, and we'll talk more about that as we go along. So this is just healthcare at a VA facility. So you may go, this has morphed over the years. So in previous years, they were just very, very clearly designated marked VA facilities, only for veterans. They would be labeled as veterans hospitals on the outside, and that is the only individuals they would take. I remember growing up, I grew up in South Bend, the northern part of Indiana, and we lived with my mom's dad, my grandpa, and we would go every 3 months and then every 6 months. I think every 3 months we went to the VA hospital in Fort Wayne, and every 6 months we went to the one in Indianapolis. So those were our fun road trips as kids, and I remember playing rummy and go fish in the lobby of those hospitals while he was having his um, regular routine doctor visits. And we were usually there for several hours because he saw multiple doctors having tests, lab work, all that stuff. So it was an all-day thing. Over the years, I've seen those kind of morph a little bit. We still have those designated VA facilities, but what I also see now too, at least in the northern area of Indiana, is they may contract with regular hospitals too. So if you do have VA benefits, which is not insurance, we'll talk more about that in a minute, you may be able to go to a regular hospital and get your VA benefits covered at that hospital as well. There might be special contracts. So you may not have to go to a regular only for the veterans facility. You might be able to go to regular healthcare providers or facilities, but they have to be designated as VA facilities as well. But there has to be contracts. And we'll loop back over to that shortly. Again, this is not insurance. You have to be approved for veterans benefits. We call them benefits. Usually they're based on a scale of your disability from your service time. So if you have hearing loss, if you have breathing issues, if you have heart issues, you have mobility issues, maybe even dementia, what percentage of your health issues, your disabilities were from your service time? If you have 100% disability, you're going to get a lot more services through the VA. If you have a lower percentage, you're going to have a lower amount of services. So that affects things too. Now, funding, their budget, that affects things as well. And you may not have your services forever. This is not a guarantee that you're going to have it for the rest of your life, kind of thing. So again, for VA services, you have to be approved. You're going to have a percentage of disability that affects things, and you can only go to a VA facility, whether that be a true VA only facility or it's a medical facility or provider and they're contracted through the VA. And then we have our Medicare. So this is National Federal Health Insurance for people who are 65 or older, people of any age who have been on Social Security disability for 2 years, and then anyone with end-stage renal disease or ALS. Now, let's talk a little bit more about how these work together. So Medicare and the VA benefits don't coordinate. So I'm going to go back on this slide real quick. So the top one, the TRICARE for Life, we already talked about that. Those do coordinate. The bottom two here, the VA and the Medicare, they do not. So Medicare does not cover any services at a VA facility. VA does not cover services outside of a VA facility or facility that is contracted with the VA and is agreeing to take your VA benefits. So keep that in mind. It's kind of an either or situation. So if you go to a VA facility, you cannot use your Medicare. If you go to a non-VA facility or non-VA medical provider that has no contract with the VA. They don't take your VA. So you can use your Medicare there if you have it. And if you go to the VA, you can use your VA there and not your Medicare. So two separates, there's no primary or secondary coordination with these two. So let's talk about things to consider and how do you know if you need the VA or Medicare or both or either or one, or what are you going to do? I've met with many a veteran over the years, and every veteran's situation is different. It's going to depend on your health. It's going to depend maybe on your disability level. It's going to depend on who are you seeing. Are all your doctors at the VA? Are all your medications prescribed by a VA doctor? Are you seeing anyone outside of the VA? How old are you? Those kinds of things. And we're going to talk about medication in a little bit because that's actually treated differently by Medicare and the VA. So, if Medicare was not confusing enough. So, the first thing to consider, if you are eligible for Medicare and don't sign up, and you don't have something that's called creditable large employer group health plan. Now, creditable means as good as or better than Medicare. And that's one of the issues with Medicare and VA. VA is not considered creditable insurance. And the reason being, VA benefits is not insurance. It is not health insurance. It's a benefit that you get for being a veteran and for applying for this. So that's why if you turn 65 or you have that 2 years of getting Social Security disability and you don't get Medicare, you're delaying it, or you decide you don't want it or need it because you get VA services, but then later on something happens and you are like, well, now I want or need Medicare, you will get a penalty. So that's usually for Part B, 10% for every year you delayed your Medicare. So if you delayed your Part B for 5 years, that's a 50% penalty. You are going to pay 50% more of that premium every month for the rest of your life. So that's something that you need to keep in mind. Or you might have to pay more for that Medicare later on. The other thing to consider is if you need emergency care and you go to a VA hospital, you might be responsible for the hospital bill because the VA doesn't pay for out-of-network providers. So you got to keep that in mind because if you don't go to the VA hospital for the emergency, you go to a regular hospital for that emergency, and you only go to the VA hospital for your medical care, and that hospital you go to is not contracted with the VA, then you're going to pay for that emergency room visit or whatever else occurred while you were there. And if you had Medicare, that Medicare would pay for most of that visit. So that's something to think about too. If you travel, again, if you have outside VA doctors, that's something to keep in mind as well. The third thing to consider is, again, if you have TRICARE for Life, you do need both Medicare A and B for your TRICARE for Life benefits to work. So that's a whole different situation. So to me, that isn't even something really to consider. If you're doing TRICARE now and you retire from military service, it's just how it's going to be. You're going to get Medicare and you're going to have your TRICARE as your secondary. And then our fourth consider is if you are the spouse of a veteran with disabilities, or maybe you're the widow of one, you may have access to Civilian Health and Medicare program of the Department of Veterans Affairs, CHAMP VA. And CHAMP VA covers some services like ambulance, ambulatory, surgery, DMV, that's our durable medical equipment, walkers, canes, wheelchairs, fun things like that. Hospice, inpatient care, mental health care, outpatient services, medication, skilled nursing care, and transplants. All right. And just a reminder, if you have questions or comments, feel free to chat those in the chat box. I do have my phone laying down next to me, so I'm watching that. I don't see anything in the chat box yet. All right, so now what we talked about mainly focused on the medical piece with how Medicare works with the VA. Now, I'm going to blow your minds and we're going to talk about prescription drug coverage because that's completely different with the VA. So, prescription drug coverage. Things to keep in mind. Some more, consider this. So, the VA does cover many medications. Now, their formulary is not as expansive as other insurances or even Medicare, but it usually does a pretty good job. And I haven't heard really any complaints from veterans. In fact, the veterans I've worked with, they're usually pretty pleased with the drug coverage. Now, okay, our second, consider this. The VA's cost for drugs does depend on the priority level. And so that's kind of like the formulary level or the tier level, like most insurance companies. And our third, consider this. So this is the big thing and what I've been kind of alluding to and the blowing your mind. VA drug coverage is considered creditable. So what did I just say on the last slide? Creditable means as good as or better than Medicare. Well, the health piece of VA benefits is not. The drug piece is. So let's say you are a veteran, you get VA benefits, and you're like, well, what do I do about my Medicare? Okay, well, I'm going to get A and B because I just want to protect myself in the what if circumstance. But you know what? The VA covers my drugs. I'm happy with it. I don't have co-pays. I'm not going to get a drug plan. I'm going to avoid that for now because I'm being told that the VA is creditable. So if I don't get a drug plan now and something happens later down the road, I can add on that Part D plan later and I won't have a penalty. So that's usually what a lot of veterans do in that case. So again, no penalties. You can add it on later, usually during an annual enrollment period in the fall, or if there's a special enrollment period if you qualify for that. And a SHIP counselor can walk you through that piece and help you enroll and help answer your questions. But again, A and B, there's penalties for not enrolling in those pieces of Medicare when you have VA benefits, drug piece, Part D, either in a standalone plan or in an Advantage plan. There's no penalties because the drug coverage in your VA benefits is creditable. Go figure. So our last, consider this for prescription drug coverage is if drug coverage and flexibility is extremely important to you, you can get a Part D plan and use your VA coverage to see which covers your drugs best. But they can't be used together, so it's still a either or situation. But that would be an option to do as well. Now, if you're just on generics, it may not be a big issue, but if you're on some heavy duty brand name meds, that might be something or a reason why to do that. All right. All right. So our co-hostess, Susan, is watching us from her event. Great info, Megan. It's raining in Indy. Well, Susan, I hope you don't get soaked, but maybe it'll cool off the weather for you a little bit and keep your bugs away in your outdoor event. And thank you for tuning in. All right, so are we worried about affording Medicare? As with any insurance, there are costs, or most insurances, there are some that don't have costs. Usually Medicaid doesn't have costs. The VA, to my knowledge, doesn't have costs. So there are some things to keep in mind. So with Medicare, there are some programs out there that we help with and we do education about that can help with your monthly premiums, co-pays, co-insurance, and deductibles. And we can help you with that either at SHIP, over the phone, or at an enrollment center. And at the end here, we'll have contact information. And that's the Medicare Savings Program and the Extra Help programs. And if you go to our YouTube page, there should be some videos on those, or you may have watched us educate on those in the past. So those can help you pay for your premiums. So if you're not sure what you want to do, you kind of want to have both your Medicare and your VA, but you're a little leery about having both, or you can't afford the Medicare, that might be an option to allow you to have both and to help with those costs. The other thing too is the Medicare Savings Program, and even Extra Help too, but because the drug piece is creditable, it wouldn't matter. But both programs remove penalties. So if you have to delay your coverage because you just didn't get your Medicare for whatever reason, and now you get it and you're going to have penalties, higher premiums, these assistance programs removes those penalties. So that's something to keep in mind too. I met with one veteran, oh, it's probably been about 2 years now, and he did not get Medicare. He didn't have Medicare, and he's a veteran, and I believe all of his services were covered by the VA, but he was starting to think maybe he needed to add on the Medicare. And I was like, well, how long have you been eligible for Medicare? Well, he's been eligible for 10 years. So that would be 100% penalty. So this year, the Part B premium is 185. So if it was 2025, he would be paying 185 plus 185 every single month, basically for the rest of his life. And when that premium goes up every year, that penalty amount will go up as well. I did screen him for the assistance program. He did not qualify. I think his resources were a little bit over. So he chose to just stay with the VA, and everything was being covered by the VA at that time. So hopefully that will continue. All right, so we do have some additional resources. So there's the United States Department of Veterans Affairs, the phone number and the website. The Indiana Department of Veterans Affairs, the phone number and the website. And you can also contact your local county service officer. They help you address local issues, help you apply for VA services, VA benefits. So there's other VA benefits besides the medical care or the prescription care. Depending on different factors, there's aid and attendance that may help pay for in-home care for you, or even assisted living. They also can help with home modifications, an aide to come in, someone to help clean, even transportation, things like that. So those county service officers really are very helpful. They're very knowledgeable with the local process. Some of them help obtain certain documents that are needed, because when you are applying for veteran services or veterans benefits, you do need to have usually a lot of official forms with very official sounding names like DA089, whatever form. And they will help you to the best of their ability to obtain those. So you can just like Google IDVA and you can find the map of Indiana and your local service officer. So I encourage you to reach out to them. They know the processes. Now, I will say they're not always in the office every day, at least up in northern Indiana in my area. Sometimes they work part-time, and they're also very busy working with clients. So you may have to leave messages. You might have to email and wait back. If you're not getting an answer, I would suggest leaving a couple of voicemails, being a little persistent, but usually they're busy helping other people. But I do encourage you to reach out to them to see what help you can get. Now, I also included in this presentation the slides. I'm going to give a shout out to Susan. She put these slides together. We used these last year for this presentation. So thank you, Susan, for letting me use your slides. But I slapped this on here, this in the next slide. This is a flyer that we put together a couple years ago for veterans. And we have this out at events. You can reach out to us and we can send you this flyer too. If you chat in the chat box or send us a message and give me your email, I can email it to you too. I pasted it in smaller batches so I could read it because I'm slightly blind sometimes. So it is slightly blurry, but the 3 screenshots are one flyer. And it's basically everything I already said, but we're just going to go over it real quick just to make sure I didn't miss anything. But we would be happy to get you a copy of this or even copies if you want it for an agency or apartment complex or whatever. So these are things to know. There are the 2 types of veterans benefits. The VA benefits, where you're not required to have Medicare. TRICARE for Life, where you are required to have Medicare. You may not have the same health benefits forever. VA health benefits are not guaranteed for the rest of your life. That's another thing to keep in mind and to think about when you're trying to decide if you should go ahead and get Medicare now. And if you think you're going to need it later, you better just get it now to avoid the penalties. And bear with me here. This is not the case for TRICARE for Life coverage. You would have it for life. All right, so you might be subject to late enrollment fees if you forego Medicare enrollment, because again, it's not creditable. Medicare and VA health benefits do not coordinate. It's either or, not primary and secondary. You cannot use Medicare at the VA facilities, and you cannot use VA benefits in a non-VA facility. I'm sorry, I got a little too close in my screenshot chopping and half of facilities cut off. VA health benefits only work at VA clinics and pharmacies. And again, like I said, over the past couple years, I'm seeing quite an increase in contracts at just what I would call regular health facilities and pharmacies with the VA. So you might be able to get services at regular health facilities with your VA, but you would have to talk to your VA facility. Usually there's social workers that can help you with that to figure out where you can go and what's approved and all that fun stuff. There can be advantages to having both types of coverages. It ensures that you are covered if you have to see a non-VA provider, and you avoid those lovely Medicare penalties. And there are programs to help pay for our Medicare premiums, and that's the Medicare Savings Program and the extra help I spoke about. All right, so this is how you can find us and call us. You can call us at 1-800-45 24800. That's our call center in Indy. You can go onto our Indiana website. You can follow us on social media. You can chat in the chat box. You can send us a Facebook message and we'll reach out to you and get you connected to a ship counselor, answer your questions to the best of our ability. All right. So I don't see any other questions or comments in the chat box. If you do have any, feel free to put those in while I'm kind of wrapping us up here and talking about what we have coming in July. And if I see it before we sign off, I will answer it. Otherwise, I will answer it later on. All right, so July. Can you believe we're in July already? It's about time to bring down the Christmas tree. All right, so we have 2 more Facebook Lives for you this month. Next week, Susan and I will be here on Monday to talk to you about the Medicare summary notices and explanation of benefits. Those are the notices that you get either monthly or quarterly that shows you the claims that Medicare received about your medical care, doctors, hospitals, lab work, all that fun stuff. And we're going to talk about why it's important to read those and open that mail, and what you're looking for and how it pertains to Medicare fraud and watching out for Medicare fraud. So that is a very, very important and educational live to tune into if you can, or at least to mark your calendar to watch the recording. And then we're going to wrap up the month on the 28th, and we're going to talk about 5 Medicare mistakes to avoid. Now, there's many mistakes to avoid with Medicare, but we're going to focus on 5 of the more important ones. So that's another important one to watch, or at least to watch the recording. And I don't have the calendar out yet. I'll be working on that shortly. But in August, we have a couple important ones too. We have Dennis Frick with Indiana Legal Services, and he's going to hop on with us and educate us on Medicaid and answer some burning questions with Medicaid for us. And then we have Social Security Administration with us in August and educating us on some of the Social Security benefits and some of those important burning questions. So, well, that is our What to Know Wednesday for July. Thank you for putting up with me all by myself on this lovely, dreary, cloudy, humid July day. I will let you all go. If you have questions, chat those in or message us and we will answer those as we're able. Thank you for listening in, and you all have a wonderful week, and Susan and I will see you next Monday. Bye, everyone.